participants today. So if I can ask you, Solange, to please launch the poll. So there we go.
I've launched it. Can you see it?
Yes, it's in the chat box. So I ask you to please let us know what your role is. So are you a researcher, a guideline developer, a policymaker, a healthcare professional, or other? And then the other question we have in the polls is,
I don't know why it moved.
Wait. Yeah, it's moving.
No, that should stay on the same
okay.
one.
It's okay. All right. So I think we're getting answers. That's great. So we have a lot of researchers, we have healthcare professionals and others. And so for those who answered others, you have one person, I think. If you can just type in the chat box what your role is, that would be great. And then the other question we have for you is whether you, so what process you follow to choose a recommendation. So do you search by developing organization? Oh, sorry, it's moving again here. Or do you search by relevance to topic? Or you search by intervention or management approach or diagnostic test? Or do you ask experts? Or do you develop your recommendation that you were looking for and then you just develop it your own? Okay. So I'll start my presentation and then just feel free to submit your votes. I see some errors occurring. I'm sure if we give it some couple more minutes, we might work it through, but thank you so much for submitting your votes. The reason why I'm asking, because as you see, the eCOVID19 rec map was built to ideally tailor for as much of a wide audience as possible. So I'm going to go on full screen. I just want confirmation from the organizers that you can see my slide. Okay, I will proceed. So for today's session, we're talking about the eCOVID19 Living Rec Map or Recommendations Map and Gateway to Contextualization. Just to let you know, this is a project that is funded by the Canadian Institutes for Health Research, and we actually have just received funding for the third year for this project. For my disclosures, so I work at McMaster University, affiliated with the Health Research Methods, Evidence and Impact Department, the WHO Collaborating Center for Infectious Diseases, Research Methods and Recommendations, and others, as Solange mentioned. And I just would like to acknowledge Professor Holger Schoenemann and the eCOVID19 RecMap team and collaborators, and Dr. Kevin Potty and the Plain Language Recommendations team. So to give you a background about recommendations mapping, it's an approach that we started just a year before the pandemic was was announced. And it was mainly in answering the WHO Global TB Department, where we developed for them a recommendations map that you can actually have access to right now if you look it up, and I can share the links at the end. So we developed a recommendations map for all the recommendations on tuberculosis by the Global TB Department. And the purpose of it was to make the recommendations by the Global TB Department available in one place and accessible for free online for anyone who needs to use them. So building on that, when we started dealing with COVID-19, we directly wanted to build a similar recommendation map for COVID-19 recommendations. So this is just a snapshot of what a map or a rec map means. So it's a tabular format. You've probably have seen it in other fields or instances. And the way it's structured is that you have populations, you have interventions, and the user would directly find the recommendation that talks about both. So the eCOVID19 recommendations map is an easy to navigate, living, freely accessible electronic platform, and that categorizes or catalogs all COVID-19 recommendations that we're able to capture, screen for eligibility, and extract information from, post it on the rec map, and also provide critical appraisal scores for it. And so the purpose of the rec map is to identify the recommendations and then make them available for contextualization and for implementation by decision makers. And this is really one of our added values for our rec map. We understood the importance of having a one-stop shop for COVID-19 recommendations, different users as mentioned. So we have researchers, guideline developers, healthcare professionals, but we also have the public, we have patients, multiple stakeholders who would be looking for a COVID-19 recommendation, but to use it differently. And we acknowledge the importance of having recommendations available for contextualization. And so we wanted to take it to the next step and have this platform available for both. So here I just want to show you that we have a large team, globally dispersed. We have at least 57 researchers right now. There are more than 65 researchers who have contributed to this project, and we have a large contribution from the Cochrane South Africa and South Africa Medical Research Council team who have contributed essentially to this rec map. But as you also see, we have collaborators across the globe from at least 19 countries. And the process for developing a recommendations map is, as you can imagine, it takes multiple steps. So starting from identifying systematically recommendations on COVID-19, so starting with guideline identification, going to screening based on eligibility criteria, moving to appraisal. For appraisal, we use the Agree2 tool, which is a common tool used that's developed and validated for guideline appraisal. If you're not familiar with it, please feel free to drop a message and I can follow up on that. And then provide scores for each guideline on the rec map. Then go to extracting data. So the extraction component was also an added value because what we did is integrated the extraction option in a software, the Grade Pro software, which is a guideline development tool. And we integrated extraction features into it so that once you build a project on Grade Pro, so a guideline, you also extract any information needed. So this guideline would appear on the rec map. And so now anyone who's developing a COVID-19 guideline, if you use Grade Pro, you can also have the feature to push it to the rec map directly. And in addition to that, we linked every recommendation to living evidence platforms. So if you're looking for a recommendation and then interested in evidence that could support this recommendation or is related to the population intervention that the recommendation is addressing, from the rec map, we linked to different platforms. Following up on that, we've done more work with stakeholders, and then we are continuously working on improvements, upgrades, and this year focused on knowledge translation and knowledge mobilization. So just quickly, because we have a lot of researchers here, I'm sure you have questions about our search strategy. So we have an ongoing search, regular basis, weekly to monthly, depending on the database. We access peer-reviewed databases, we access grade literature, the guideline development organizations. We also have collaboration with the Health Information Research Unit at McMaster University, who are in charge of running APIs and web scraping on a daily basis from big databases. And then we also reach out through personal contacts and networks to guideline developers, researchers, and global groups to ask them what guidelines they're working on or developing. In terms of eligible guidelines for the rec map, they have to be guidelines that meet WHO definition of guidelines in any form, whether they're new, updated, adapted, adopted. They're based on earlier guideline, and we did not restrict to any COVID-19 topic or population group or language. We have our team who uses different translation tools to capture guidelines from other languages and translate them and have them on the rec map. In terms of Agree2, if you are familiar with it, Agree2 has 6 domains. You calculate a score per domain, not an overall score. And we focus on 3 of those domains because due to work that our team has done on previous topics, we've come to a conclusion that 3 of those domains could actually reflect on credibility, those being scope and purpose, domain 1, rigor of development, domain 3, and editorial independence, domain 6. And the way they're scored is on a Likert scale. And for each domain, a score by 2 scorers is calculated using a formula. The agree-to tool would give you more information on that. And for translation, we reached out to the team, their network, and we used Cochrane Task Exchange. Now, in terms of extraction, I'm just going to take you through GradePro. So this is GradePro. If you're not familiar with it, this is a guideline development tool. Typically, in a guideline development effort, you have GradePro and you create your project. So this is a project that's already been extracted that I'm going to use. You click on the project, you access the different PICO questions inside a guideline, and for each PICO question, automatically, the way this is programmed, you develop a PICO question, and then you go to develop your recommendation. And so you enter the details of a certain recommendation or a good practice statement. That's something that we'll talk about at a later stage. But the purpose of this is to show you that we've integrated extraction features. You can see here on the top, we have the agree-to domain scores. We have the title, the publication date, different fields that we had agreed on as the eCOVID19 RecMap team as important for extraction. And we extract all this data and then push them to the RecMap. So whether a declaration of interest was there, the guideline described as rapid or living, latest state of literature search, for example, and then we code and tag each guideline and its recommendations with population intervention codes. In addition to that, we also look into the Progress Plus equity related components. So the Progress Plus is a framework by Cochrane Equity. If you're not familiar with it, we look at whether each guideline, for example, addresses through its recommendations, place of residence, race, ethnicity, culture, language, occupation, gender, sex, religion, education, socioeconomic status, social capital, and other components. And so we go into all these details and then we push the details to the RecMap. If you don't have access to the RecMap, it's covid19.recmap.org. I would ask the organizers if they could paste this into the chat box for our attendees today. So covid19.recmap.org. And from the homepage, you can go directly to the RecMap, choose a recommendation. So this is slow just because we've uploaded some things today. You choose the intersection, you choose a recommendation, and all the information that we extracted on GradePro, you'll find them on the RecMap. That includes the evidence to decision tables. If you're not familiar with them, this is a framework the Grade ETDs is a framework by the Grade Working Group, and it lists at least 11 criteria depending on your type of question, so effectiveness or management and so on, that are important to making the decision for the recommendation. So what's the problem of priority, what the evidence on desirable effects, certainty in the evidence, values, balance of effects, and so on, including feasibility and equity. The final judgment is done by the panel, and then the direction and strength of the recommendation with justifications. So this is, this session is not about telling you how to develop a guideline, how to make judgments or the ETDs, but just so you know that the level of things that we've gone through in the RecMap to make sure that we're covering as much information as we can for different users. And we also provide a list view on the RecMap where you can find all the recommendations just listed there without the map format. And the way, again, this functions is that in the map format, you have the populations on the left, and the intents on top for the columns. Under each intent, you'll find a list of interventions. This is all coded by our extractors, by our team. And for each intervention or population, we provide a code. The code, we try to make it as consistent as possible with international coding systems, so ICD-11 or ACT and SNOMED, so that when we're working with other platforms, we can have a common language. We added filters to make it easier for our users to find the recommendation of their interest. And you'll see in filters, you can find source, you can find agree scores. Sorry, maybe this is cooler here to show you directly from the RecMap. The publication year, whether a recommendation is adapted, agree score, the word region that is covered by the recommendation, the age group, and so on. Now, the other thing is that also on our homepage, you'll find what we call our project in numbers. It's a summary. This is updated on a weekly basis every time we upload recommendations and guidelines. Right now, as of July 11th, so the next upload is the coming Friday. So these numbers are from the last Friday. We have 429 guidelines that have been captured, judged as eligible, appraised, and extracted on the rec map, amounting to 6,061 actionable statements or recommendations. And if you enter every recommendation, you find the agree score on the right, just like I mentioned earlier with the certainty of evidence and the recommendation strength. And I just like to stress out the certainty of evidence recommendation strength is something that we extract as it was published. It's not a judgment that our team does, but the agree to score is, so the critical appraisal is part of the work that our team does. And on the rec map, you have a toolbar on the right to help you navigate throughout the page of the rec map. And we link to, we provide you with a link to the living evidence platforms. So at this stage, it's the LOVE platform by Epistemonicus and the Norwegian Institute of Public Health's living evidence map, the EpiMap for COVID-19 evidence. The other thing is that if the recommendation has an intervention that is covered by the essential medicines list by WHO, we also provide a link to that. So I'll just stop here for just 1 minute before introducing a new concept. Any questions or anything that is not clear for any of our participants today before I move on? All right, I don't see any questions, so I will go on. So, sorry, just sharing again. Oh, I can share, okay, I'm sharing. So the other thing is, while we were doing all this work to capturing, appraising, extracting, pushing to the rec map, we were also able to do a lot of research work. And in particular, also building on the previous work we've done with WHO Global TB, but also a lot of the work that our the experts on our team and those who have been involved in guideline development for a long time, we were able to give some thinking to the different types of actionable statements that exist within a guideline. So those of you who have participated in a guideline development group or who have been working on guidelines or who are very familiar with reading guidelines, you'll realize that there are statements that are giving action that are there, either placed under a remark or other places in a guideline that could have served as an informed recommendation, for example, or a good practice statement or other types of statements, but they could come in as a lot of overwhelming information and some of the, not very awesome about how to deal with them. So what we thought of is how to identify the different statements that exist within a guideline. And I won't go in details into this, might not be something that you're very familiar with, but just to let you know that one of the great outputs of this rec map was being able to develop a taxonomy and classification of existing actionable statements within a guideline. So you have a formal recommendation, which is a recommendation that has its certainty of the evidence, it has the strength, it is supported by evidence, and you can see the direct evidence, a chain of decisions that was done there. But on the contrary, you also have statements that are informal recommendations or actionable statements that are there in the guideline that don't have a strength, don't have a certainty, have not been supported by direct or indirect evidence clearly. And in another place, you also find good practice statements. So at the end of this slideshow, I've listed the links to all these resources. I highly recommend you take a look at them, but also just so that you know what it is that on the map that we're trying to say when you find statements that are good practice statements, others that are additional guidance, and others that are recommendation. When it's labeled as a recommendation, it's typically a formal recommendation. When it's labeled as a good practice statement, if you enter it, you'll find there's criteria. We provide a judgment per criterion for why we call this a good practice statement, not a recommendation. And for additional guidance is a statement that is not a formal recommendation and has failed at least one of the criteria for a good practice statement. The other thing I wanted to let you know today is that you can also use the feature of contextualization through our rec map. So contextualization is when you find a recommendation that's relevant to a PICO question of your interest. So it addresses a population of your interest, intervention, comparator ideally, and you want to look at how this recommendation could apply locally. And so you follow a process to adapt it. If you don't need to adapt it, you'll adopt it, which is the first step of adoptment. If you need to adapt it because you have local evidence that could bring in more information on its feasibility, on the equity, on its costs, then you'd adapt it. And otherwise, if you don't find a recommendation that answers what you're looking for, then you are going to be developing a recommendation de novo. And just having all these three concepts together, so adoption, adaptation, and de novo synthesis, is a term that we call adoptment. It's a term that the Great Working Group has put together and actually added it to the lexicon. You'll find a paper on that. And we have provided access to adoptment from the RecMap. So what happens, for example, if you are interested in a particular recommendation and you want to contextualize it, you scroll all the way down, or so you scroll all the way down and you can fill in your name and your email address, and you inform us what it is that you actually are planning to do. So I can say I have a team of 5 members and are interested in contextualizing. And you send in this request. And what happens is our team contacts you with access to this project. So as you see here, I have been invited to a new project that I asked access to. I added to my Great Pro account, and then I can access this project. So once I'm there, as this is loading, I get to access all the information that's in this project. And if we start with, should exhalation valves versus no exhalation valves be used in respirators and non-medical masks? If this is the question that I'm looking for, so you see here, this is related to good practice statement. Sorry, not the ideal statement I was looking for. Should be, yeah, there we go. So this is, so we're going, sorry, change the question to, should universal masking versus no masking be used in healthcare settings in areas of known or suspected community or cluster SARS-CoV? So for this question, this is typically the form that we would fill. The team has completed the information or research evidence because this is what was available in the guideline, provided the judgment. And there's information on values, on balance of effect, on resources, and on equity, acceptability, and feasibility. And if I want to adapt this to local context, what I can do is, sorry, this is just taking a second here. There we go. What I can do here is, sorry, my machine is working against me in this moment. I'm just going to stop sharing for 1 second for this and come back to it. So what I'm trying to show you is how to request adaptation or adoptment. And what we are going to do, and let's go back to the screening. There we go. Sorry about that. So I'm going to click here on this arrow. I have a list of all the questions in it, and I can create adoptment. Once I create adoptment, I choose the question that is of my interest that I want to adapt to my local context. It will show me all the questions that have been addressed. I choose the question or questions of interest. And then a new project has been created. It says adoptment here. I can access the question itself, and I go to the different components. And then what I can do is for each criterion, so for example, this one, certainty in the evidence. There's data on the certainty in the evidence for universal masking versus no masking to be used in healthcare settings in areas of known or suspected community or cluster SARS-CoV. This is the original evidence that was used to support the judgment for the original recommendation. I now have an development box where I can add the evidence that's related to my local context to support my decision. So similarly for values, I can add any evidence that's related, make my decision based on the new evidence, and then at the end, I'll be able to compare the decisions that were done originally on the recommendation when it was developed compared to what changed in terms of these criteria and the judgments for them for the adapted recommendation, and then make a final decision for the adapted recommendation in terms of whether it's strong or conditional, so strength, and towards or against the intervention in terms of direction. Sorry. So this is just to share with you how the adulthood process is integrated within the RecMap. Before I proceed with other additional analysis we've done, just again reaching out to see if anyone has any questions or anything you'd like me to repeat. And I'll check the chat box for now.
There is nothing in the chat box now, but perhaps I can ask, how much interaction have you had with, guideline developers in other parts of the world or in various parts of the world in using this for development or for other purposes? What is the impact? Have you looked at it?
Thanks. Thank you so much. That's a great question. So there are different ways to measure the impact. And as you know, we need some more time to look into that. The first thing is, in terms of understanding the use of the RecMap, we do have our Google Analytics. You might know Google Analytics is banned in some countries at this stage, but from the countries that we're able to access data for, we follow up on a monthly basis the users, how many people are coming to the RecMap, how long they're staying on the RecMap, and what pages they're mainly checking. And this is helping us in prioritizing different topics for extraction or for developing plain language recommendations. That's something I'll talk about in the next stage. And we know that there's a lot of use of the RecMap. We are currently in this third year of funding. We're focused on knowledge mobilization. And then during this year, we'll be working with different groups. So we have a specific subcategory of the project focused on working with clinicians to see how to improve it. Throughout this year, we've worked with citizens and people from the public to see how to improve accessibility and the presentation in the RecMap, but also the work we've done on plain language recommendations, which I'll refer to. And then in terms of adultment itself, we have had successful projects for adultment, such as, for example, the Czech Republic and in Brazil. So they were able to identify recommendations of interest through the RecMap and then work locally with their ministries of health to adapt recommendations that are local. And what we're actually doing is, because we offer to then republish the recommendations that are adapted to the RecMap, we also are providing that in the RecMap. So the impact is for the RecMap, for us, we know there's a huge impact, people are using it, but to focus on the indicators, this is this year. So this year we'll be seeing indicators and actual measurement of impact. In terms of patients, we've developed plain language recommendations, and we know those are being successful from the people we're talking to, but we have a trial that's currently ongoing to test the plain language recommendation template and use. And for the adultment, we know it's been successful in at least 2 countries, and as we go, we'll learn more about it. And I'm just showing here the results of, if you choose the filter of adapted, you'll see the list of adapted recommendations on the RecMap. And here you'll see in the title, there's the Czech language, because this is the result of the Czech Republic's adultment work that took place through the RecMap.
Great, thanks. Thank you.
Okay, so I'll just take you through what else we were able to achieve throughout this work. In addition to taxonomy on different types of actionable statements, we also looked at whether recommendations answering or addressing the same PICO question or saying the same thing. And it had come to our attention that they were not, that there were recommendations that were diverging. We chose the word diverging recommendations to describe recommendations that are answering the same PICO question to some extent, but are giving different results. It's a paper that I definitely suggest that you take a look at, and it has helped us look at things in different ways. So how were we able to mobilize quickly for the RecMap? We had expertise in evidence synthesis and guideline development internally in the McMaster team, but also within our global collaborators. We established collaborative activity with partners and organizations in terms of the searching, contextualization, network of collaborators to share the workload, IT. So Evidence Prime is the group that built the RecMap for us and is also the group behind GradePro. And so this is why we were able to directly integrate within GradePro some changes and then push information to the RecMap. We had prior experience with WHO TB RecMap. We worked, and then the work developed incrementally. And then we've had experience in coordinating large projects. So the key 3 lessons that we learned from the work so far is that 1, the map highlights gaps in responding to some priority COVID-19 topics and multiplicity in other topics. 2, the recommendations for COVID-19 should be available for a different audience at the time of need. And 3, COVID-19 guidelines are continuously developed and the RecMap needs to be maintained to host them. So that's it in terms of the RecMap in general. Just for the coming 5 minutes, I'll talk to you about what we call the plain language recommendations. It had come to our attention that it's important to find a common language that speaks not only to healthcare professionals or guideline developers, but also researchers, but also to patients. How much of COVID-19 recommendations can patients actually, or the public can they actually process, or how much of the information in them can they actually process and take in and be able to make their own decisions, for example. And so building on previous work that our teams have done, we were able to develop a template for plain language recommendations. And the purpose from its name, present the information and the recommendations in a language that is plain. We use a grade 8 level for language, and we've used the GIN toolkit for developing the content, but also we've worked with multiple people. We have a large team to be able to make the plain language possible. And so we've covered a list of topics throughout the years, and these are continuously updated. If a recommendation is out of date, we retire it from the RecMap. Typically, we also retire the plain language recommendation, update it when a new one is out there. The way to access it is from the RecMap. One of the filters, you click on plain language recommendations, click on available, you find all the recommendations that have a plain language recommendation, or from the toolbar on the right. We've attempted to translate to at least 13 languages. For the coming year, we're probably going to stick to 5 in terms of because of feasibility. And just to also show you that for plain language recommendations, we've integrated it within GradePro. So the way it works is that we go to a certain recommendation, although work for it is filled, and then our team develops the plain language recommendation for it. And I am going to find it for you. Just give me a second. So the purpose of a plain language recommendation is, the place to find the plain language recommendation is on the filters. Choose, make sure you've cleared your filters. Common mistakes, sorry about that. And then you choose, and there you go, a recommendation with the plain language recommendation. And you find it right now in the stage in English. We have a trial that's ongoing that's testing this template with 3 different groups, parents, youth, and adults. We're at the last stages of the recruitment process for these groups. and hopefully soon we'll learn more about whether we need to make any changes or updates or edits to the plain language recommendation format. At this stage, it includes the recommendation text, who it is for, what the recommendation strength is, why this recommendation, so why conditional if it was conditional, what additional information are important, benefits and harms, and what does it mean to the person reading it. If you want any more information about it, we have a list of webinars, and I'm also going to share the links to the different resources in the chat box, and of course you'll have access to the slides after this presentation. So that's it from my side. I want to check in with Tamara Credo if there's anything you'd like to add about the rec map. Or talk about your experience with it, maybe. Or
yeah, thanks. Thanks, Tamara. Thanks, Solange. Hi, everyone. Yeah, it's great to be together. Oh, you know what? I'm seeing myself because you're sharing your screen. That's why it's so unnerving. I'm like, why am I looking at myself? Okay. Can you? Yeah. Okay, that's better. I think it's a very. I mean, you've presented a very massive project in as simple way as possible, but there's a lot of technical back end work, and I think for those that have worked in grade, what you showed is probably quite familiar or can be navigated, but for many it might be quite new. So I'm just thinking you need to, are you in a light sensitive place? So just in terms of my contribution, so I'm one of the partners on the project with Tamara and Holger and others. And because all of us globally, COVID was happening at such pace, it became necessary to firstly share what we could. And then when it came to guideline, it's such a massively intensive, resource intensive, expensive endeavor. The idea is, how do we adapt from what's already out there? And I think that's why this recommendations map is useful for people, patients, people who need to make decisions, but also policymakers. And we have also tried to use this in South Africa. I think the challenge that we had is that with COVID, some of the data moves so quickly that by the time we were making a decision, you know, the guideline that we wanted to adapt from was out of date. Things have slowed down now a little bit with COVID, and I think there are a few places where we're hoping to explore using the recommendations map more. But I think the learning from extracting all of those COVID guidelines, looking at the appraisal of them, and then also looking at which recommendations were divergent, which ones were the same and why. So there's been so much learning, and then unpacking that in addition to recommendations, you had the best practice statements, all these other statements that get kind of hidden in a guideline, but actually trying to understand what they're about. So I think there's been a lot of learning there, and ongoing. And I think the phase now of kind of getting the evidence used, understanding what people's preferences are, is really great. But yeah, I think there are a couple of questions coming through.
Yeah, so there's a question from Kim, and she's asking if the platform provides several recommendations for the user to make an informed decision.
Mm-hmm.
yes, that's a great question, Kim. And thanks, Tamara, again for putting the scene, for setting the scene for, we typically don't select which recommendations to present, right? So we capture a guideline. If it's an eligible guideline for COVID-19 and based on the definition of a guideline, it provides actionable statements, then it will be extracted, appraised, and it will be on the rec map. We don't select which recommendations to present and which ones we don't. We simply retire those that become outdated, and their developers have either retired them themselves from their websites or have published a more updated version.
Can I just, so similar to that is, I think you mentioned it very briefly, but so for example, if two different organizations have produced a guideline on a similar question, but their recommendations differ, do you put both of those into the map?
Yes, and that's why we're presenting it in a map format where the intersection cell for the population intervention is going to present you with any recommendation about that combination. So even if it's from two different organizations that are saying contradicting things, and that's why we ran the analysis for whether there's diversions there. We don't select, we present it all. Users will do their own informed decision making, but from our end, we present the appraisal of the guideline in terms of quality.
And Solange, to say, I mean, for the South African COVID guidelines, where I'm part of the National Essential Medicine List COVID guidelines, we have then been able to search the recommendations map, and then rather than do agree to ourselves, we use your appraisal. And because we know the team, we also ask you for more details, so we get appraisal of all 6 domains if we want. But I mean, really, it saves us time because we're not doing it from scratch. So that adaptation is a key part of it. And the same way that we use evidence from other sources, trying to cut as many corners, not in terms of the rigor, but in terms of not wasting resources for work that's already done.
That's great.
Exactly.
Anything that saves time and resources is fantastic.
And we've had requests from teams who are looking into appraised guidelines, but also teams that are going to conduct a systematic survey of existing guidelines on a particular topic or intervention. And so they'd reach out to us and we provide them with a list of guidelines that answer their question from the RECMA.
Great. So just checking if any more questions from our audience, feel free to type it in the chat box.
Yeah, and what do you think about guideline adaptation and using this development where you can use a guideline and use the elements that are static and use them, adopt them, but then bring in other factors? I don't know if anyone has anything if they've had any experience with that or what they think about that. Because this is a learning space. It's a number of projects around the world are looking at how do we best adapt in transparent ways, credible ways.
If you would like to speak, you can raise your hand and I can unmute you. Okay, another question from Kim. Yeah, but please do raise your hand if you would like me to unmute you. Kim is asking, can you share how popular RecMac used during COVID? How popular was it during the COVID pandemic? What are the intentions for dissemination?
Yes, for sure. So I was just trying to see if I had the numbers from this morning, because I know this morning we did share the new numbers and the executive meeting anyway. So for example, in the past week, we've had 600 new users of the RecMap. That's just a number that I can tell you right now. So from June 2020 until June 2022, we had at least 120,000 users of the RecMap. Is that a measure of popularity? That's why this year we know we need to have their indicators and follow up on those. Before this June, we were really busy in getting the methods out there, focusing on how to build the RecMap, how to develop the different things, how to address different audience. This year is going to be targeted message delivery and measurement of performance and impact. Intention for dissemination, well, really we're co-developing our knowledge mobilization plan right now, and we're looking into approaches that have been described and trying to see what approach works best. So if you have any particular experience in any of the dissemination strategies that exist or anything you'd like to suggest to us, we're more than happy to learn about it. And I'd actually take this opportunity to also tell everyone that we always are looking for more hands on deck. So if you have interest in learning about plain language recommendations, how to develop those, and you have some time for that, we're continuously recruiting volunteers or interns. We can put it in an internship format. And similarly, if you're interested in learning more about using GradePro, extracting guidelines, or appraising guidelines, please do let us know. We'd be happy to have you on board.
Great. Thank you.
Mm.
Any last burning questions?
Yes, I have a question whether other groups or whether you are, whether the McMaster group are planning to, it started with TB and creating that WHO recommendations map, which I have to say that we are looking at and using potentially here in South Africa. But COVID is another one. But, will there be, a space for other guideline topics?
Yes,
And especially
for sure.
ones that are relevant for regions like ours.
For sure. So the way we're doing it, integrating Grade Pro and so on, we're doing the work in a way that is replicable, well described, improvements are ongoing, and we want it to be available in terms of resources for any other topic, right? It's not COVID restricted. We did develop the TB rec map, this rec map. We also have developed a WHO COVID-19 rec map that's specifically for WHO recommendations on COVID-19. And we did develop 2 maps for the Canadian Agency for Drug and Technology in healthcare. So, it depends on who's requesting it and, of course, resources. So let's say you are able to apply for local funding for a particular topic that you want to develop a rec map for. We can collaborate and get that done. It is right now being considered for a particular type of cancer. I cannot give more details right now, but it is being considered for another topic. And yeah, so that's the plan.
I mean, I could see how in South Africa, with the guideline that we have, the essential medicine list, the formulary, how it would be really nice to be able to have a recommendations map so that you can click on the medicine and see how it's recommended. And so it looks like Grade Pro and Evidence Prime, they've got a way of being able to capture things and present it in this recommendation map format. I think that might be really great for users. But
sounds like
we
a
will
great
see.
project.
Yeah, and also just to reach out to people to say, if you are interested in getting involved in learning how to appraise or extract, get in touch with any of the Tamaras. And we can explore, or students or others who have dedicated time available and could explore a bit further. Thanks, Solange, and thanks, Tamara.
Sounds great. I hope some here will take up the opportunity. Thank you again, Tamara Latvi for presenting, and Tamara Credo for being part of it. And thanks everyone for attending and participating. I'm just going to share in the chat the link to evaluate this webinar. We welcome, please, your evaluations. They help us to improve these webinars. They will also be shared when we disseminate the presentation and the link to the recording. So thanks again, everyone, and enjoy the rest of your day.
Thank you so much.
Thanks, everyone. Take care.